Friday morning. Over my time on council, I've tried to increase awareness and attention to the cost drivers in the city budget, and healthcare is one of them. And if you look at the city budget in 2005, 2006, we had like 670 employees. Now we're down to like 600 employees, and yet our healthcare costs have doubled. And that $5-6 million increase every year, every dollar there that the taxpayers are paying for healthcare for our city employees is a dollar that can't be spent on public safety. It can't be spent on community development. It can't be spent on our city and the priorities that we have. That doesn't include employee costs that have risen as far as premiums and deductibles are concerned. Last year, and it depends where you look in the state of Pennsylvania because it's different by region, but a couple numbers is like the average cost for healthcare for a family of four is $20,000 with another $6,000 coming out of pocket. Those numbers, we don't always see those numbers. We actually rarely see those numbers because that money is coming from a combination of employers, taxpayers, citizens, and also people just don't want to tell that story. Like my full-time job, as many of you guys know, is I teach over at Allen High School. And like those kids sometimes, and I'm probably the last person that you think a 17-year-old would want to tell their healthcare story to, but those numbers are real and the stories are real. And everybody that showed up tonight to tell their story deserves credit because it's not easy to get up there and talk about what you don't have in your life. And we've all been in a situation where it's really easy for people to look at us and not say anything, but you're thinking something as far as like either not having sympathy or not having empathy. And like people don't want to tell these stories, but they're true. And if you've looked at the last 10 years and you look at the Affordable Care Act, and the Affordable Care Act has done wonderful things. It expanded coverage for over 20 million people. It covered people with pre-existing conditions. People are able to stay on their health insurance longer, but it has not reduced the cost of our healthcare system dramatically. Premiums have been driven up for a lot of people. Why? Because insurance companies are being forced now to cover people that beforehand they would never want to cover. They wouldn't want to cover those people beforehand because they weren't people that they were going to make money off of. Last year, and I'll give you some numbers, last year, healthcare in the United States cost about $3.65 trillion. A year earlier, it cost about $3.5 trillion. With baby boomers retiring, and these numbers are all from the Center for Medicaid and Medicare Services, when you look at what's going to happen with healthcare in the next 5, 6, 7 years, that cost is going to go from $3.8 trillion to $6 trillion. And that money's not falling out of the sky. And the question about who's going to pay for it is like the same people that are paying for it now. And that's who's going to pay for it. And that $6 trillion is going to be paid for. And this doesn't even include the states that haven't even decided to expand Medicaid yet. And when you look at what's going on here, the only two real questions that we have here is going to be, how do you drive down costs? And who's going to pay the $6 trillion bill? And who's going to pay it? If nothing changes, it's going to be us. The taxpayer is going to keep paying, whether or not it's me who teaches in a school district downtown, whether or not it's cities, whether or not it's counties, whether or not it's federal government, whether or not it's Medicaid. So who's going to pay that $6 trillion bill? And I understand a few people, and I didn't call anybody in city council. I didn't even call the mayor. Because I wanted people to bring their own opinions to this. And I'm sure there's skepticism. I'm sure there's thought about, why are we doing this? This doesn't have a chance to pass and things like that. But some of what this is about, it's about having the courage to talk about the change that needs to occur and show the people at the federal level that we support having a conversation. And I understand, trust me, I understand the value of practical change and practical plans. When I released Bethlehem 2017 a couple years ago, and we were looking at climate action and Northside 2027 and neighborhood opportunities and innovation and transparency and accountability and ending the digital divide, I spent a long time, and I still do, thinking about how do we build up organic structures? How do we create actual solutions to this plan? And that's all about creating lasting, meaningful change. But some issues, you don't get to be the drivers of change. Some issues, you are just a voice. You are a voice that is bringing awareness to an issue and education to an issue. This resolution is not about answering every question about how these programs are going to work. It can't be, and it shouldn't be. And there are also several other current ways out there that people talk about national candidates for president talk about this. Congresswoman Susan Wild talks about this, about things that have a much better chance of passing. And if those come along, absolutely as incremental steps, we need to take those, whether or not it's public option, lowering the Medicare age, national negotiation of prescription drugs, whatever it might be. Those are all individual good steps. But at the same time, like, that's not what is going to drive down the cost of healthcare. And that's not what is going to continue to eat into the percentage of our GDP that is being taken up by healthcare. And like I said, it is a legitimate question about who is going to pay for Medicare for all. It's an even better question about who's going to pay for our healthcare if we don't do something and if we don't pass something. And passing this resolution does not make it less likely. And we can't continue to say people aren't ready for a conversation. If I told you that over the next 10 years, the federal government is going to spend $25 trillion on healthcare, you'd be like, wow, that's a lot. That's also what they're going to currently spend between Medicaid and Medicare. And when you look at local municipalities and school districts and everything else, that's what the government is already going to spend. Okay. So I would just finish up by saying is like, this is a vote about understanding the magnitude of the issue. It's a vote about showing the courage about where we're going to go. So one of the speakers talked before about how Congresswoman Wild is signed on to this bill in Washington, and she talks about it a lot, about how like we need to have these conversations, and people didn't send her to Washington to have the conversation or be scared of having the conversation. And, you know, I don't think that this is something that we should necessarily be scared about as well. So I would just hope that my colleagues would consider supporting the resolution that I brought forward. It's about showing, you know, not just our leaders in Washington, but also our community about, you know, what we think meaningful change is going to look like. It's about who we are as a city. It's about who we want to be. And it's about how we want to serve the citizens of Bethlehem, and how, like I said, we can't always create the change. Sometimes we just need to be another voice that says we are ready for the conversation and we are ready to support whatever you need to do in Washington.